and they are purely the anatomy and pathology. They are testing your knowledge. We are going to come in details for that, so the marking scheme. But now we are going just to enumerate the stations. So in the skills part, you have 2 history stations, 3 physical examination stations, and 2 communication stations, and 2 procedural stations. So these are the numbers of the stations you're going to get in the exam. Okay. There are very important details. We're going to take to talk about them, how to prepare for each part of them. Okay. So very important details. Yeah. But now we know that we have to pass the knowledge part and the skills part. For those who recently passed part A, yeah, and I think so the majority of you just recently received the result. Okay. So they're not going to face that much, like it's not a big deal for them to pass the knowledge part. And just to reassure you guys, majority, maybe 90 something percent of non-UK graduate, they pass the knowledge part. They don't have a problem in it. Okay, we're going to talk. Yeah, so that doesn't mean you don't need to prepare. Yeah, you need to prepare. You need to prepare. Okay, and you need to work hard for this exam, guys. You need to work hard, actually. Okay, but working hard alone is not going to pass you this exam as well. Exam is very easy. The exam itself is very easy, but it's designed to be like hard exam. Designing of the exam itself. Okay, so you need to work hard and smart at the same time. So you need to work hard and smart for this exam. So as we said, they're going to be Oscar station. There's small details, guys, but they're really important. The structure of the exam. So as I said from the beginning, this exam is designed to be like a stressful exam. And as a surgical exam, and as you are going to be a surgeon in the future, as a surgery is a stressful job. So this exam is designed to stress you. Okay, so to check that, or not just to stress you, yeah, and to check that you can work under stress. So the examiners are looking at these things. They are looking at these things. Okay, so like there'll be so there are 17 stations, but there'll be 20 stations. Will be 20 candidates at that day, because so these 17 stations, these are the marked stations. So you are going to get marks on these stations. But there are two preparatory stations. So there's no marks for preparatory station. For communication stations, there's no marks for preparatory stations. Okay, and there are 1 or 2 rest stations. Okay, and also you are not going to receive any mark for rest station. You're just going to be resting, drinking tea. No one is going to give you mark in drinking tea and and drinking water. Yeah, so there's no marks for so there's no mark for rest station, and there's no mark for preparatory station. Okay, so when you start the exam, guys, the 20 of you, the 20 candidate will be standing in front of their stations, and there'll be scenario behind you on the wall. Okay, so there'll be scenario behind you. So this how the exam is designed to be stressful. You don't know which station you're going to get or you're going to start with. Okay, so understanding this is really going to help you in your preparation. It's really, really, really going to help you in your preparation, guys. So the scenario will be behind you. Then there'll be microphone. So this microphone is going to say, now read the scenario. So now the exam started. Okay, so now the exam started. Then you are going to turn to the scenario. You have 1 minute reading the scenario. Then after that, they are going to tell you enter the station. Okay. I don't know, guys. Everyone can hear me, because there's one of the doctors said he's not or she cannot hear me. Everyone can hear.
We are hearing clearly.
Yeah. That might so I think it's your connection, Dr. Sahaj. So or Sahaj, I forgot your name actually. So just if you log out and come back again, I think that's maybe it's your connection, or try another connection, because I think all of them can hear me clearly actually. So guys, just I'm explaining how stressful this exam, how it's designed. So you are going to enter the station. whatever station you're going to have, you are going to have one of the 17 stations, or yeah, one of the 17 stations. So we don't know actually whether it's anatomy, pathology, critical care, examination, history, procedure, you don't know, communication. So you don't know. So you just knew when the last minute. So you don't know which station you're going to start with. So that's the first thing to stress you. Okay. So you might get any station. You might start with any station. So many people like they prepare themselves. I'm going to start with knowledge. I like to start with knowledge. No, be ready to start with any station, guys. Okay. So might start with knowledge, might start with procedure. Many people hate procedure, especially the junior doctors. They hate procedure, but you might start with procedure. Okay. Yeah. So just be ready. This exam is designed to assess that you can work or you can perform under stress. Entering the station. Yeah, so they can hear actually. Can you type? Can you type in the chat, guys, or someone? Yeah, just let me type on the chat too. Yes, they can. Okay, so you're going to enter this station with the examiner, whatever the station you're having. The microphone is going to tell you 6 minutes. So 6 minutes, this like indicator for the history and examination to stop doing what you are doing and present your case. But for other stations, for example, if the examiner is asking you knowledge questions, it's like indicator for the examiner. They need to speed up the questions. The examiner is taking their time. They have many questions. They need to speed up to finish the questions. Okay. After you finish this station, the microphone will say to you, now leave the station. Guys, you're going to go straight away to the next station now. There's 1 minute. So can you imagine how this, yeah, you have 1 minute, go to the next station, read the scenario, and then enter the next one. And you're going to go, yeah, until you finish your, yeah, it's going to go like this until you finish your it's 17 stations, but you are going to go through 20 stations. You're going to go to the preparatory station. You're going to go to the rest station, have some tea, drink some water, and as I said, there's no one who's going to give you any mark for preparation and the rest station. So no one is going to mark you for drinking tea or having some rest. Okay, so you're going to go through these stations. In sometimes the rest station is just one station. It depends on which center you are taking the exam in. So in some centers, there's only one rest station. Some centers, there are two rest stations. Okay. So it's really important, guys, to understand how the exam design, because it will save you a lot of yeah, it will save you a lot of pressure. Understanding that and preparing to all that, because in your preparation, the target is exam date, guys. Is not the target is not just improving your knowledge or memorizing everything, or no, the target is the exam date, guys, because many candidates they work very hard preparing for this exam. Even they take 6 months, more than 6 months, but they are not prepared for the exam day. And what will happen? They're going to like have mental block in this exam day because they didn't prepare the correct way for the exam. So this exam really, guys, is practical exam and it need preparation for the exam date. So your target is the exam date. Every preparation from the beginning, start preparing for the exam date. Okay, you are not preparing just to memorize, just to, yeah, you don't, yeah, you make effort for some time, and then you're going to be good, guys. You're going to be very good, and nothing will stress you. And actually, we have. I think many of you are not in our group, but we had a lot of colleagues from our group. They scored because they prepared the right way, so they scored very high scores in this exam. Very high scores. Okay. Yeah. So and yeah, before I go further, I want to ask this question. Answer this question. So, what about the language? What about the English? Guys, just be reassured. They are not looking for very perfect or fluent English in this exam. No. No. So understanding what they want from you. Because I have many colleagues in our group, their English is like medium or below the medium level. They passed this exam with very, very, very good high scores, guys. So for those who are not using English in their daily life, yeah. So for me as well, I haven't been. I wasn't using English like yeah, on a daily basis. I'm not English speaker. I'm not like yeah. Even I just studied my medical school in English, and I even in my country we don't even practice English. We don't even practice English every day with patients. Even with our seniors, we don't like practice proper English. We just present you our case, and even we can include some Arabic words. Yeah, for those who know, yeah, this. So, oh, thank God. Yeah, so it's not an English exam, guys. Just yeah, because I know many colleagues asked me this question, and I'm going at the end to answer any question you have, guys. Okay, so don't worry, prepare well, know how to prepare, know how the exam is structured, and then you are going to be fine, guys. Okay, so when to book for this exam, and for example, which center to book? This is one of the most asked questions, right? So is there any difference between the exam between the four colleges? So is Edinburgh easier than England? Is Ireland is the most difficult exam? Guys, the answer is no. The answer is no. The exam is a standard and it's called intercollegiate exam. So there's a standard between the four colleges that they want this standard. So the answer is no. The exam is the same. And even the exam in them, like if there's exam in this week for England and Edinburgh and Glasgow and Ireland, they're going to cover the same topics. Okay, so this is how the exam works. And even if you had your part A with Edinburgh, you can switch to take part B with England because, for example, this center suits you and there's England exam coming soon. You can take part B with England and Ireland or Glasgow. Even after you finish or you had your membership, if you want to like go from England, like now you pass part B and you have membership with England and you want to go for Edinburgh, for example, because Edinburgh they reply fast for the email, they answer very quickly the phone calls. Yeah, so many people prefer to be membership with to have their membership with Edinburgh, so you can do that. So in the exam itself, there is no difference, guys. There is no difference. The exam structure, the questions you are going to get, the standards, they are the same between all of them, and it's called intercollegiate exam. Okay, the difference between maybe the organization, the management, and the like admin things. Okay, so England they have problem answering the phone, answering the emails, and this stuff. Okay, but the exam itself, there's no difference. What about the centers? So, guys, if you prepared well and understand what this exam about, I don't think the center is yeah. There's any problem with choosing any center except guys UK centers. Yeah, I'll say it. Except UK centers, they are really high standard. So the top of the standard is going to be in the UK centers, guys. And this from experience actually. From seeing many colleagues who had the exam in UK and outside the UK, anywhere outside the UK, there's a difference. And the difference is not that much, guys. Actually, I did a calculation what the difference between UK centers and non-UK centers. So the difference is between 3 to 4%. So many colleagues who had their exam in UK and then the second attempt outside the UK. What the difference? I did calculation from many colleagues. So the difference between 3 to 4%. Even this, if you prepared well and understand what they want from you, 3 or 4% is not that much, right? because most of the candidates, they want to pass this exam, and it's okay to pass because scoring high score is not it's not a big deal. It's not going to like do anything for you. Just now you have the membership, right? So majority of colleagues, they pass this exam like just borderline. So the 3% is is like a huge difference, right? Because I know many colleagues, guys, many colleagues who failed the exam part B with 1 mark. With 1 mark, I know many of them. They failed this exam with 1 mark. Okay, so the majority of the people or the colleagues or the candidates pass like borderline. Okay, so if you prepared well, don't worry about the college and don't worry about the center. Okay, and I'm going to tell you how to prepare well. Actually, if you prepare well, you don't worry about them. The difference is 3 to 4%. It's not that much. Okay. For those, so you passed the part A preset. So it's better to book as soon as you can. Don't rush. You are not in a hurry, but because you are fresh or like knowledge is fresh, okay? You don't need to wait long time. I don't mean like very, very long time. What I mean by long time, very, very long time. So when you're ready, and my advice is have a look at the curriculum first of the MRCS Part B, for example. Have a look. It's available everywhere. So and even online. So you can check it online with the Royal College. So check the curriculum, and then try to book as soon as you can. Okay. How long do you need to prepare for this exam, guys? One of the most asked questions. Guys, 3 months enough to prepare for this exam. Okay, so and actually the recommendation of the Royal College themselves is between 3 to 6 months. 3 to 6 months. Okay, but if you like, it depends in how busy you are, how much free time you have. Okay, so 3 months is enough. I know colleagues did it in less than 3 months. So I know some colleagues from our group, they did it and they prepare for this exam for less than 3 months, and they pass with a good score. I'm saying good score here. You don't need to like aim for a good score, very good high score, but if you pass the exam, that's enough. Okay, you're going to be the member of the Royal College. So the material, I think the material is available everywhere. Okay, so the material, so to get like 80% of the questions in this exam or the material, 80% of the material are available everywhere. Okay, it's not that big deal, it's not a problem. So there are very small difference between one and other material. Okay, and actually I prepared my own material, so and I try to fill that gap. So what are the difference between the material? Okay, so what can help you? What can help you to study in this? So how this material? So let me give you my approach for the material, for the knowledge, for example. What I have noticed in the other materials, for example, that's what I did in my website actually. So the anatomy, I've noticed many colleagues struggle with the anatomy because the anatomy is not going to be like part. Just let me share the screen to show you this. So the anatomy is not going to be like part A MCQ. The anatomy is going to be like part of the body or picture. So and they're going to identify. So total difference different from part A. Okay. So just 1 second. This is simple, like simple picture of anatomy, for example. Can you see the screen, guys? I can't see the chat. If you can tell me when open the mic and tell me, can you see the screen?
No, screen is not there. We cannot see the image.
Okay. Just 1 second. So for the anatomy, this example for the anatomy, can you see it now?
Yeah, it's clear now.
Yeah, so this example for the anatomy. So you're going to enter the station, you're going to be faced with pictures, anatomy pictures. Okay? And you're going to be like under that stress, under that pressure, to look at this image and identify the structures. They'll be in the station 2, 3, 3, 4 pictures. So one label, like 3 label, 1, 2 labels. They're going to ask you to identify the structure, question related to that structure, identify the structure, question related to that structure. So guys, if you look at this picture, I had one of the colleagues who having exam like recent Part B. So when I surprised them with this picture, they thought this is so you I think you are familiar with this part of the body, right? All of you. So when I surprised him with this picture, he was thinking straight away brachial plexus. So can you imagine how far this from brachial plexus, guys?
Yeah.
Yeah, but because you familiarize yourself with specific materials, seeing like very limited pictures is going to confuse you, because you are from the beginning you are going to look for the labeled part, right? So in the exam under stress, and it might happen to many colleagues, even in our practice, when I just showed you this picture from the first time, you're going to look at the label, for example, and oh yeah, it looks like brachial plexus when you look at the labels. So that's why I'm talking about the importance of the material. So what I did, what's my approach for the material, especially for the anatomy, because many colleagues struggle with this identification. So in many materials, you have like just textbook picture with like many labels, many labels. Okay, and that's what people like used to prepare, and that's really hard, guys. Really hard, and will consume your time for preparing for the anatomy. It will take like majority of your time, preparation time, studying anatomy. So my approach is providing like different pictures with the most important things being or repeated things being asked in the exam, instead of showing you like a textbook picture with 30, 40 labels. So like 5, 7 labels. So the most asked part in the exam, the most asked like muscle smears and blood vessels, for example. And also I added, because this worked for me actually, that what helped me. So I started with anatomy myself. So and also I like linked video to any anatomy station. So there's a video. If you see that video for 2, 3 times, it's not going to be a problem for you to identify or to memorize the extensors of the forearm or flexors of the forearm. For example, the basal skull like anatomy, the foramen and this stuff. So you see the video for 2, 3 times. And guys, what I'm going to do, I'm going to give access for the first 10 who are going to text me now. I'm going to give them access for that material. The first 10 are going to text me now, okay? So I'm going to give them free access for that material. So this is my approach for the material, for example. For the pathology and critical care, so I saw the difference between all the materials. So I saw the difference between all the materials, and yeah. So I saw the difference between all the materials, and I add the different questions. So this material, like in this station, has like 2 or 3 questions more than the other materials. Okay. Yeah. So that for the knowledge part. For the skills part, guys, there's lack in most of the material, and it's not about material, guys. The skills part is not about material. Trust me. Why people struggle with the skills part? Because they don't prepare well for the skills. Okay. This exam is practical, and you're not going to learn, guys, to do procedure or to suture or to do nervous excision just by reading it from a book. No, 100% you are not going to learn it. Or performing chest tube or catheterization. You're not going to learn it that way, guys. You have to practice. You have to practice it. And to be ready for this exam, guys, it has to be in your subconscious, because the exam is designed to check like things in your subconscious. You're not going to use your conscious in this exam. It's designed to be very, very stressful. So you need to repeat the skills. Repeat, repeat, repeat. I know all of us, they know how to examine the knee, for example, the abdomen, for example. But this exam is different. And that was what we are going to talk in like the marking scheme. Okay, what they want from you. So guys, the skills part need practice from day one. It has to be like second nature. Yeah. And that was the doctor is saying. It has to be your second nature. So because you're going to get like 3 examination stations from the all examination stations available, like we have more than 20 something, 30 examination stations, you're going to get 3 of them under that exam pressure. So what do you need to be ready? What do you need to do to be ready? Yeah, so practice. And I remember one of our colleagues who passed recently, he said he practiced until he get bored. So guys, the skills part need practice until you get bored. Not only practice, not only working hard, because many colleagues, as I said at the beginning of this session, many colleagues been practicing for 6 months, but they're been practicing wrong because they're not familiar with the marking scheme of this exam. So they have been practicing, they have been doing the examination, but they failed the exam, guys. They prepared very well and they worked very, very hard, guys, very hard. But there's very small things, but they're important things in getting marks in this exam. Okay, so we're going to know them. So maybe attending our session in the future. So we're going to speak in how to get more marks in each part of this exam. So just to let you like doing the examination, just and taking the history, guys, and doing the procedure, suturing, excising the nerves and this stuff. In this exam is about 50% of the marking, and you cannot pass the exam is scoring 50%. So the pass of this exam is 65 to 70%, if you understand what I mean. So just practicing them without knowing how this exam is marked, you are going to get the 50% of the marks. Okay, so the other 50% is not about practicing. It's not about doing the maneuver or asking the history questions or doing the procedure and suturing and this stuff. I'm going to share the screen in a minute and tell you how, show you how this this exam is marked. Okay. Yeah. So, guys, important thing. One of the things that can help you in this exam to score good is communication. I don't mean communication, the communication station. No. One of the things, can you imagine, guys, there's part of the examination station called communication. You are going to get 4 marks for communication in the examination. You are going to get 4 marks in the procedure for communication. You are going to get 4 marks in the history for communication. Okay, so this will bring us to like to show you how the just let me share the screen, how this exam is marked, the marking scheme. Let me show you the screen. Can you see the screen, guys? Please let me know if you can see the screen.
Yeah, we can see it, but
I know.
very small.
I'm going to zoom. Yeah.
Yeah, zoom it. Thank you.
Yeah, you're welcome. So, guys, this is how they mark the exam. So, if you look at the domains here, so first of all, the examiners required for each station. So, if you look at the knowledge stations, 1, 1, 1, 1, 1, just one examiner. Okay, just one examiner. For this history and communication, you are going to get surgeon examiner plus lay examiner. Okay, for the history and communication. For the procedure, for examination, the 3 examination is going to be 1 examiner. For the procedure, you are going to get examiner and assistant. Okay, so examiner and assistant, and all the knowledge 1, they history and communication examiner, lay examiner, the examination one examiner, the procedure examiner, and an assistant. Okay, so what they are looking for, or how they are marking this exam. So if you look at the left side of the screen, so first of all, clinical knowledge and its application. So this is going to get marks in this exam. The second thing is clinical and technical skills. Okay. Third thing is communication. Fourth thing is professionalism. This is how the exam is being marked. Every station is going to be marked out of 20. Okay. And understanding this is very important, guys, because it will, show you how to practice. Okay. So the knowledge station, the pathology and anatomy is going to get out 20 out of 20, just answering the question and answer. Okay. So when you answer the question, they're going to give you a mark. That's it for the anatomy and pathology. But for the critical care, for example, the knowledge part of it is 12 marks, if you look at it. So 12 marks in answering the questions. Clinical and technical skills is going to be 4 marks in critical care. Professionalism is going to be 4 marks in critical care. Okay. Let's show you, this is going to surprise you, I think, because even those who have been practicing to prepare for MRCS for a long time, they surprised with these things because they've been preparing, or preparing or practicing wrong. People, when you tell them about history, or so they think just about asking the history questions. And the college knows that you can ask the history questions because you went to medical school for 6 years, and you did your internship. And even some of the candidates are consultant in their countries. So guys, it's not just about taking history. If you look at 8, the mark 8 here, so this for technical, clinical and technical skills. So that means your questions, your history questions you're asking for this patient, you're going to get for them just 8 marks. And many candidates prepare that wrong way. So they prepare just asking the history questions. Because they have 6 minutes. They stress about memorizing every single question in these 6 minutes. Okay, so they have been concentrating in that. So they are going to get 8 out of 20. So I told you that many people have been working very, very, very hard for this exam, preparing for this exam, but at the end they fail because they have been just practicing these 8 marks out of 20. Maybe they have been practicing the 4 marks as well for the knowledge part. So you're going to get 4 marks for the knowledge. So the examiner is going to ask you differential diagnosis, investigation, and treatment. So maybe they're going to get these marks as well. Okay. But in the 6 minutes, even in the 6 minutes, it's very hard for them to get the 8 marks because it's really hard, guys, to take perfect history in 6 minutes. It's very hard. Okay. So even the 8 marks, they're not going to get all of them because it's very hard, guys. It's very important, guys, to understand this point. Okay, majority of people, candidates preparing for MRCS, just working for these 8 marks, and it's really hard to get these 8 marks in 6 minutes. So there are other 4 marks for communication and 4 marks for professionalism. Okay, so knowing how to practice to get these marks. For example, I'll give you the example, building relationship with the examiner, hand sanitizing, showing empathy, your clinical judgment, and these things. If you look here at the professionalism, decision making, problem solving, situation awareness, judgment, organization, and planning, patient safety, all of these things they ignore in their practice. Actually, they ignore in their practice, and they lose majority of the marks in this stage because it's really hard, guys, to do or to take proper history or perfect history in 6 minutes. If you understand what I mean. If you go to the examination, it will be the same. So the same thing, examination for technical and clinical skills, you are going to get 8 marks. So doing the examination, let's get abdominal examination, for example. So doing the inspection, palpation, percussion, auscultation. If it's appendicitis, doing the Rossing sign, Sower sign, rebound tenderness, and this stuff. So doing all of this, you're going to get 8 marks. And again, it's sometimes for some people who are not too fast or who are not who don't practice well how to get all these tests in 6 minutes, it's going to be difficult for them. So for those who can practice like in a good way, in a correct way, to get the marks. Okay, so it's going to be difficult for them to get the 8 marks. So the easy 8 marks is difficult. It's going to be difficult for them. Okay, so if you understand, guys, what I mean. And then again, there's 4 marks for your knowledge, 4 marks for your communication, and 4 marks for the professionalism. Okay, going to the communication stations. So communication stations again, like the people concentrating, like memorizing every single word they have been studying in the preparation. Okay, just memorizing without paying any attention to the patient, without even listening, interact with this patient, and they want to pass the communication station, for example. They have been working very hard, guys. They have been working very hard for a very long time, but they have been preparing wrong, guys. Why? Because they will go and memorize their communication, even the phone call once, guys. So the communication, we have 2 communications. We have communication with person. So you are going to speak to patient, consent them or counsel them about something, or patient's relative, for example, patient's mother, patient's wife, or son. Okay, so that person communication. Okay, so what the majority of candidates been doing in this communication, for example, they memorize the material by heart. They enter the station, and memorize this material with the actor. And guess what, guys? The clinical knowledge or the clinical knowledge in communication is just 4 marks out of 20. You understand how they've been preparing wrong for these stations. The clinical knowledge in communication, both of them, person communication and phone communication, is 4 marks. And that's how what the people concentrating on. People have been concentrating on the 4 marks. So we have 16 marks for communication and professionalism in the communication stations itself. So the other part, the people will go and memorize. I had many colleagues who like told me about their stories about the phone calls, for example. Some of them, even they didn't know that there's patient notes, the preparatory station, we spoke about it earlier. So you are going to study patient notes, make some notes, and there's a specific approach for a phone call for calling colleague. There's a specific recommended approach, how to summarize this file or this patient notes to communicate it to your colleague. So you are going to go to another station after finishing from this preparatory station, after finishing from 9 minutes, studying the patient notes, making your own notes. Then you are going to go to the next station, which is the phone call. You are going to pick phone as in real life. So pick phone, dial a number, and speak to a consultant. So there's a consultant on the other side of the phone. It's not going to be with you physically. You're going to speak to them through the phone. Okay. You're going to communicate your patient problem, whether you are asking advice, updating your senior, booking a bed, for example, for this patient, or want to refer this patient who need urgent intervention, for example. You understand what I mean? So the people will go and memorize what they have in their notes. So what they have in their notes is just an example for this phone call, how it's going to be. So the people have been preparing like, they go and so I think, so the people will memorize and just go and memorize this information they have been preparing for the examiner. And guess what, guys? I'll show you what the examiner are looking for. Guess what? Just by memorizing this phone call, so you're going to be a liar, because nothing of this information mentioned in the patient file. Maybe the main symptom or the major symptom that this patient involved in RTA, and they're having limb fracture and they're having pulseless limb. So you'll not be lying about this, but they'll be lying about the patient age, patient name, patient investigation, patient everything. because it's not going to be as you have in your. So they gave you something to read and like summarize it, and they want you to present that summary. They don't want you to present your previous knowledge. They don't want you to cram the station. You understand what I mean? So that's how the yeah. So the clinical knowledge in this part is just 4 marks, and the 16 marks picture of. So guys, the clinical knowledge is 4 marks. We're going to get the questions in a minute, guys. So the clinical knowledge is 4 marks, but professionalism and communication is 16 marks. So are you following, guys? Are you following so far? Guys, because we are going to like discuss an important part. Okay. So let me just share the screen again. So this is an important, like an important part. I already received many texts. So we have 1, 2, 3, 4, 5. Yeah. Just let me share the screen. So this important part as well, guys. So what the examiner is looking for in this exam. Okay. Just to understand, it's not about guys working hard alone. So working hard on this part. Okay. So what the examiner is looking for in this exam, guys. Can you see the screen? Can you see the screen, guys? Please let me know.
Yeah, you can see it.
Thank you. So, guys, the examiner, and they're going to tell you this, guys, in the briefing. So, in the briefing, there's every exam has like supervisor and assessor. So, the assessor is going to be on our side. If you have any complaint about one of the examiners or one of the actors, you're going to complain to that assessor. Okay. And they're fair, guys. This exam is really fair, and the mark you got, you're going to get at the end is your mark, guys. Is your mark. Yeah, I know you worked hard. Many colleagues work hard for the exam, but they have been preparing in a wrong way. So that their mark. We're going to know how they get that mark, because guys, you're going to face like 17 examiners plus 3 lay examiners. So at least you're going to face 20 examiners, 20 or 20. I don't remember the number exactly, but you're going to face all of them. And this exam, guys, designed to be fair. Designed to be fair. So how someone can fail you? You looked at the marking scheme. So how they can fail you? It's really hard. Okay. So unless you really failed in this station, you're going to fail. And one station is not going to fail you the exam. Even 2 stations, they're not going to fail you the exam. And you're going to hear many colleagues' feedbacks who had the exam. The examiner, they treat them fairly. They were very nice, actually. So it's important to understand what the examiner is looking for, what they want from. So if you look at the last question in the red, so would I like this candidate to work in my department or not? So the examiner are looking for that thing, guys. Oh, this is a good candidate. Yeah, you should pass this exam. This station, not this exam. He's not going to go with you for the next station. He's going to be in this station, whatever the station is. He's going to be, and so the examiner is going to mark you according to this. Okay, it's not just about your knowledge, guys. And that's what the majority of the colleagues being doing. They think this exam is about your knowledge. This exam is really about your performance, because that's how the examiner is looking at you. Is this candidate good enough to work in my department or not? If you give them that impression, they're happy about that, they're going to pass you this station. Okay? Because, as I said again, there's limited marks for the knowledge. So they're looking for confident, like surgical trainee. I'm not going to say confident surgeons. confident surgical trainees, because this exam will prepare you to enter the training exam. For example, ST3 or CT3, right? So they're looking for that person. So can I rely on this candidate to like run the department I'm working on or in? So they're looking for confident, safe doctors. Okay, that can empathize with the patient. Okay, so showing empathy is really important in this exam, and professional. Yeah, so they're looking for that at these things, guys. And I remember, and you are going to, yeah, so you're going to go for Part B, and you're going to have this briefing. I remember the supervisor said to us, and he's going to say to you, guys, you are going to perform our future laboratory. So one of you, one day, is going to perform laboratory for one of the examiners. Yeah, that's how they like future things work, right? So they're looking for these things. So if you are lying, for example, about the last example we gave about the phone call, if you are lying, you are not honest. How they can trust you with their life? How could they can trust you with their patient, with their department? Definitely, they're not going to trust you guys. If you are memorizing the phone call from your notes and just go and present them lying about everything, the wrong information, giving them wrong information, you are not going to pass. Definitely, you are not going to pass because you are not honest. How can I trust you with my patients? How can I trust you even with myself? How can I trust you to perform laboratory on me? If you understand what I mean, guys. Okay. Yeah. So, guys, remember this exam is really expensive. 1100, I think, around 1100 pound. So it's really expensive, and you need to prepare well, not just working hard. That all 100% of the candidate worked hard for this exam. It's not going to pass you. Not just working hard, guys. Working hard and smart. Okay. So yeah, understand what it's exam about. Okay. Yeah. Yeah, you need. Yeah, I think we mentioned that 3 to 6 months to prepare for the exam. Yeah. So look at it here. It's even written here. So you will be doing our laboratory in the future. This is what the examiners also thinking. Okay. So they want someone confident, guys. They want someone safe to trust them with even their lives. Yeah, we spoke about this exam format. 17 stations, 2 preparatory stations. Yeah, and 20 marks for each station. I think we spoke about this. Yeah, all the stations are manned. 3 of them are doubled, as we said. Not three, more than three, because we have the communication and the history and the assistant in the procedure. Yeah. Yeah, so they're testing very wide range, guys. Very wide range. Uh, Knowledge and skills actually. So if you are not prepared well, it's really hard to pass this exam because it's really designed to check your skills, to check your knowledge. It's not just there's no luck involved actually, guys. There's not any luck involved. Okay. Guys, there's important thing from day one, guys. I know many colleagues will say to you, I'm going to start with the knowledge and then go to skills. No, you have to pass them together, guys. You can split your day. So I'm going to start in the morning because I need to memorize the knowledge. So in the morning, I'm going to do the knowledge part. In the afternoon, I'm going to do skills. Guys, don't just memorize the skills or read them from your notes. You are not going to learn how to examine or how to do procedure just by reading it from book. So have study partner from day one, guys. It's not have to be perfect. So you are going to improve. So find a study partner from day one. Really important, guys. Really important. Guys, I think more than 50% of those who's having their exam, I know from those I know and having the exam, they're complaining now about their preparation. I have many texts, many colleagues text me. Oh, I'm really struggling with this part. I'm thinking about canceling the exam. I'm thinking about no, guys. For those who understand Arabic, guys, ورطت نفسك خلاص ورط نفسك تمام. ورطت نفسك خلاص ما في شماعات تاني ما تفتش لك اي شماعات. So guys, you don't need to feel that at the end of your preparation you are weak at specific part of the skills because you have been memorizing. You are not going to pass with just memorizing skills, even score the full mark memorizing knowledge, and even if you score the full mark in knowledge, they're not going to pass you with the skills part. You're not going to get the membership. So from day one, start with both knowledge and skills. Okay. Yeah. So as I said, there's no luck involved. Okay. And very important thing, guys, being robotic in this exam, that's what many candidates are going to do in this exam, and that's how they have been preparing for this exam. They're being robotic, memorizing things, but the examiner, they are looking at real life scenarios. So pay attention to that, okay? I think explain this. So you have 1 minute. So in some centers, I don't think it's where it's there nowadays. There's bell. So 1 minute bell, 6 minutes whistle, and 9 minutes bell. But it's going to be microphone most likely, as we explained earlier. So yeah, we're not going to repeat it again. Guys, it's really important. The 1 minute outside the station is really, really, really important. I'll give you an example from let's take in procedure outside the station will be written wear gloves outside the station. Okay, and there'll be gloves outside the station, so you need to wear gloves and enter the station. Many colleagues, they'll not pay attention to that part of the instruction, so they'll just enter the station. The examiner, so the exam started now. The examiner is going to send them back. Please go outside and enter and wear gloves. Oh, that's going to stress them. That's going to let them think the examiner is not happy about what I did. Did I do something wrong? I'm wasting my time. I have limited time to perform this procedure. So all of these things will come to you. The examiner send you back. Right? Right? So yeah, so please carefully, and all of this is going to like end by practice. Practicing in a correct way, guys. You're going to end all of that stress. Okay. Yeah, being confident is really important. Being confident, very, very important. Okay. Yeah, obviously don't say any inappropriate things. Okay. Yeah, guys, again, being robotic, being interested. So if you have patient, guys, consider this patient as your patient, as you at your hospital, at your clinic. So they are looking at that. They're looking at how you are dealing with this patient. Are you dealing with this patient as an exam actor or a real patient? It's obvious, guys. It's very easy. I'm not examiner, and I've been doing this for like I don't know how long now, but it's not that long time. But I can tell if this candidate taking this actor as real actor or they're just memorizing. Very easy to tell, actually. How about examiner being doing this for 10 years? Very easy for them to pick. Actually, I've seen examiner in my exam. I had seen examiner in my exam. I was in rest station, and the examiner was the examiner the in front. So you can see that. So there might be like the door open in front of you, and you are in rest station. You will see even what was going on inside that station. So that examiner was the station was examination station, and I was in a rest station. So I was looking at that station. Guys, the examiner wasn't looking at the candidate at all. For the 6 minutes, the examiner didn't look at the candidate. And it's very easy for them actually to say if this candidate is doing well or not. Very easy, guys. Because you're supposed to communicate your examination steps with the patient, right? And you have 4 marks for communication in this exam. So he didn't even need to look at at the candidate performance, how he's doing the maneuver, because it didn't concern him. So this maneuver, which maneuver they are following, it didn't concern the examiner, and it doesn't concern the Royal College as well. So it doesn't concern them which maneuver you're following, for example. What concerning them, are you confident? Are you polite? Are you empathize with this patient? Are you communicating well? Are you safe? Yeah, that was concerning them. They can pass you if you fulfill this important things. But they're not concerned about doing maneuver, proper knee examination, and doing McMurray test, Lachman test, or what else, anterior drawer test. That's not concerning them, guys, because you went to medical school. You have been learning this for 6 years, and you did your internship. And as I said, some of you are consultant in their countries. That doesn't concern them at all, guys. You understand what I mean? Okay. So that examiner wasn't looking at all at the maneuver, at the steps, was just listening to that candidate. Okay? Yeah, so have to prepare well, as I said, work hard and smart. Okay? Mm, so, yeah, so this important advice, actually. So, if you performed well, bad in one of the stations, and actually, guys, many colleagues called me after the exam, at the same day of the exam day, they complain about one station went very bad. It happened. So every exam I had this calls. Every exam. They'll call you. I performed very bad in that station, the procedure station, the anatomy station, that whatever station. That is the station yeah. Some of them they have yeah. But because I know most of them, they have been practicing with me, and I think to all of those who I said to them, you are going to pass, you are good. Don't worry about this one station. Alhamdulillah, they passed. They passed their station. Alhamdulillah. So I remember one of the supervisors was, guys, if you are performing very bad in this station, so if this station is like the question getting tough and tough, that means you are doing very well, or very bad. You understand what I mean? Okay. So having one station in this exam, bad station, it's not a problem. It's not a big deal. And some candidates, or many candidates, they're really concerned about the examiner's um, expression or facial expression, what the examiner happy about, what I did, what I performed. Guys, that's not a big deal, because most of the examiners are mask faced. They have been trained to be that way. They've been trained to act that way. Okay. I remember one of the supervisors said, telling a story about one of the candidates. So that candidate did 7 stations of his exam. In the middle of the exam, decided to quit and leave the exam. So he said he tried with him, the supervisor tried with him, but he failed to convince him. So he quit, he left after 7 stations. And the supervisor said when he went back and checked his mark, he passed, guys. He passed all of the 7 stations, even with good mark. But he was concentrating on the wrong way. He was concentrating with the examiner. He was concentrating with the examiner's interaction, whether they mask this, whether they're happy. So he was doing that, and he decided. So he could have saved £1,100, 6 months of preparation. That stress, that exam stress, right, guys? So why candidate fail this exam? Obviously, inadequate preparation and inadequate experience. If you don't have good experience in doing the procedure, but by practice you are going to learn it. So you have 3 months preparation, and 2 months, 1 month is enough if you're doing procedure, suturing every now and then. It's going to be okay. So, yeah, I know some of the colleagues are fresh graduated, um, but they have good time to prepare, to learn how to do the procedure, how to do proper examination, how to take perfect relevant history. Okay, so we are going to get there, guys. Who command in English? Actually, I have many colleagues. I started with these guys. I have many colleagues from this group. Um, even I have been guys from when we take like one of the stations, I'll ask them to repeat the station from the beginning because there are many English mistakes. There are many robotic things, but they pass. This exam is very good mark. So good preparation is going to help you if even if you are not good at English, even if you are not fluent at English, just good preparation. I remember some of them who scored 140 something. So you need 116 to pass the skills, for example. But yes, see, they scored 140 guys by just good preparation. And they are below like the middle or they just barely can say right English sentence. I swear, guys, wallah lazim, that's what happened in this group. So by good preparation, you're going to get there. Okay. Uh, yeah. So making exam difficult. So and they're going to tell you guys, there's nothing is going to surprise you in this exam. So, yeah, the exam is going to come from your material. Nothing is going to surprise you, and they're going to say that to you in the exam date. Even the supervisor is going to say that to you. Okay. And guys, the Royal College have has copy of our material we are using. So because one of the colleagues, one of the candidates, I think in London Center, forgot to take his sheet or book from there, and yeah, the Royal College they know that we have all these materials, but it didn't concern them. Didn't concern them at all because they are looking at your performance again, as I said. And I remember one of the colleagues who passed recently said their supervisor said to them, isn't it surprising, guys? We have been repeating these questions since 1990 something, and still people fail this exam. Yeah, it's really surprising. It's really surprising because people are preparing in the wrong way. People are treating the exam as an exam, and they don't want you to treat this exam as an exam. They want to treat it as real life scenario. They want you to deal with this patient as a patient. Okay, how they assess you. Yeah, as I said, there's no killer station. They doesn't exist. They don't exist. Nothing will surprise you. They're going to tell you that. The examiner. Don't worry about the examiners. As I said, they have been trained to be mask based. Some of them, or many of them, will be very nice, smiling to you. Yeah. Okay. But that doesn't mean they give you the mark. Even some examiners can give you the rest of the question, the rest of the answer. If you didn't answer the full answer, they're going to give you zero, guys. Trust me. They give you the rest of the answer with a smiling face, but they're going to give you zero. That's their expression or their facial expression is not going to affect your score. Mask-based examiner, maybe you scored 100% of this station, but still the exam is going to be mask-based. So don't worry at all about the examiner's expression or these things, guys. Because I had many colleagues said to me the examiner was happy about this station, and yeah, but at the end, and even they corrected my answer. They gave me the rest of the answer, were smiling with me and chatting with me, but at the end they failed the exam. And I remember these guys when I went to Edinburgh prep course before I had my exam, how uh, how they are marking the knowledge. So in the knowledge part, if you give the first answer wrong, and the examiner gave you a mark, they put zero. Just you corrected it, you realized you gave it the wrong answer, and you corrected it at the same time. The exam is not going to give you the mark. Yeah, yeah, that's what the wrong college is saying. They're not going to give you the mark. And remember, I think many of you heard this. That your previous colleague, they are going to tell you the stations I had in the knowledge, they are the same stations from this material or that book. Yeah, all of them, they're going to tell you that. But the question, guys, if you ask them about their score, it's going to be 100 less than 20, 100 something, 18, 17. Why they didn't score the full mark? They're not lying about the having the questions. They're not lying, actually. You're going to have the questions, the same thing, the same question, the same order. But why they didn't score the full mark? Did you ask yourself that question? So because someone, when they telling you, yo, I had this station, like in the same order, the same questions from this material or that book or that material, and that will happen actually in the exam. Guys, did you ask them that question? Why you didn't score the full mark? Why your score is just 118 or 19 out of 160? Why there's more than 40 marks missed here? Because they have been giving wrong answer, thinking that they're answering right. The examiner have been smiling to them, giving them the rest of the answer, thinking that they answered right, but at the end they scored just 119. So guys, carefully, one of the strategies answering the knowledge. If you don't know the question, 100%, don't answer it. That's it. Don't answer it. Ask the examiner to go for the next question, or ask the examiner to come back late for this question. Because if you say to the examiner, skip this question or pass this question, it happened to many colleagues. So they said skip. When they finish their questions and they want to go back for that question, the examiner already gave them 0. So they ask the question, oh, I have a question I didn't answer. So the examiner will say to them, you said skip. I'm not going to go back to that question. So carefully, so to say to the examiner, I'll come back to it later. If you understand what I mean, I'll come back to it later. Don't answer it. Don't answer 1, 2, 3 questions. Don't worry. You're going to remember them, okay? And don't worry about the examiner's facial expression. They're not going to change anything in your score. Yeah, so I think we explained this point. There's a assessor who would receive your complaint about any examiner or actor, and there's supervisor as well. So yeah, these obvious things. So you have to like wear above elbow. So yeah, so that's obvious. Yeah, and don't overdo things, guys. And patient safety is more. Yeah, so remember, guys, it's the most important thing in this exam, patient safety actually, and this exam is patient centered. This exam is patient centered. So remember, this is the mentality how you're going to prepare for this exam. If you're going to prepare for this exam as an exam, guys, you are going to fail. You are going to fail. So prepare for this exam as just an exam, you're going to fail. Okay? And at the exam date, treating the exam as an exam, you're going to fail. Trust me. The most important one in this exam is not the examiner, not the supervisor or the assessor. It's not it's the patient themselves. Okay? Yeah, so, and remember, this exam is very basic, guys. Yeah, and it has limited knowledge and designed to be like very basic because it's not like the end of the training. So this exam for training entering, right? Yeah, so and you're going to get there by practice. So working under stress. So by practicing, you're going to get there. Yeah, I think that's all, guys. So guys, if you have any question, just like raise your hand and we're going to take your question, guys. And even if we have some of colleagues who passed this exam, they can help us with telling us about important things if they want. Yeah, Dr. Hamid, you have the mic.
Yeah, yeah. Thank you very much. You explained the things very well. I just want to revise these things and have a few queries which will help everyone who is in the group. First thing, you are told about the 17 stations. So,
Dr. Hamid, your voice is not clear. Just if you can.
just a minute. Let me off my.
Yeah, so I can't hear you well, actually. I don't know if it's.
Is it clear now?
Yes, yes.
Yeah, I just want to revise the things so that the things will be clear to everyone. 17 stations, as you are told, out of the 17, 50% of the stations are knowledge based. Is it right?
Um, Three anatomy, two
50%, half of the
critical care,
stations.
not 50, less than 50. So six, seven, eight station are knowledge. Yeah,
Eight
eight
stations are
station
knowledge
knowledge, and
based
nine
and
stations are skills.
for communication skill as well as history taking and everything, all that.
Yes, nine skills stations and eight knowledge stations.
So, what was my question regarding this? As the exam is based, so the person who has passed recently Part A, hmm, so if he appears within 3 months of giving Part A, so his knowledge will be already fresh. So
Yes,
it will be he will be more concentrating on the skills and the. So
yes.
what you advise? Should we wait for 6 months or we should immediately go for within 3 months of passing A?
More than enough. 3 months more than enough. And I think I started with this. 3 months more than
Yeah.
enough. And we have some colleagues who did this in less than even less than 3 months.
Thank you. That
Trust
is
me,
very
trust
clear.
me. If you prepare well and you understand this exam, what is this exam about, 3 months is more than enough. But many colleagues preparing for even 1 year, but they have been preparing wrong. They failed this exam. But if you understand what this exam about and how to prepare for it, you are going to like even less than 3 months is going to be enough.
Yeah.
Yeah,
The next
one of the
part,
one
which
of the important things, guys. Also, there's this app. What's called Anki. I forgot to mention it. It's going to save time in knowledge, yeah, like memorizing the knowledge questions. Instead of repeating all the knowledge, you are going to like repeat the questions that you are not answering right. So consider it in your preparation as well. So that the Anki app.
so the
I
next
forgot to
thing
mention it.
was choosing the center or the college, Edinburgh or England. People are stressing much on that. As you are told, it
Yeah,
is just make a difference of
that's
three
a
to four
wrong thing
percent.
actually. Yeah, yeah,
That is a false interpretation of most of the people on the Telegram groups. They are
yeah.
discussing about Edinburgh and Edinburgh and Edinburgh means even if you are getting a center nearby, he is leaving it and going other country for Edinburgh. Is it advisable or you should not
Yeah,
go for that thing?
I don't advise UK centers because they are really, really high standards. Because many colleagues, so from experience, they had the exam in UK and the second attempt was outside the UK. They pass it very easily. Okay, but for the other centers, Middle East centers, for example, um, it doesn't matter. Let's take example the Abu Dhabi center. Yeah, just to confirm this like theory. So Abu Dhabi, like two exams, the pass rate was 70%. But the last
Fine,
Abu Dhabi,
fine.
yeah, the last Abu Dhabi result, the pass rate was 40%. Guys, this exam is fair. They're checking, yeah,
Okay.
That's
yeah,
my exam.
they're marking, yeah. So the pass rate was 40%. The last Abu Dhabi exam.
Okay. One more question. Are there real patients at some centers or all are there
Yes.
actors?
Yes, there are real patients sometimes. So if you had stomach examination is going to be a real patient, varicose vein examination is going to be a real patient, hydrocele examination is going to be a real patient. It happened to many at many centers. Fistula, AV fistula examination is going to be a real patient. Okay. Yeah.
Fine, fine. Coming to the actual question regarding your course, how you are arranging the course for this communication skills and all that, because theory part and knowledge part can be covered on the Zoom or in the books or any of the material, but how these skills and mock stations will be done through your course. Have you got any plan that we
Yes,
just
actually, we have been doing that. We have been doing that for a period of time, for a long period of time now, and I think we have some colleagues who had this course and pass. So it's going to be video meeting. So if you are performing the examination, and even in the real exam, it happened in some centers. Even during COVID time, the real exam, some centers they have like video examiners. So it's okay. It's totally fine. You're going to perform your examination on an actor, and we're going to give you the feedback. We're going to perform your procedure. We're going to give you feedback. So that's how we're doing it, and it helped. All the candidates did the preparation online with us, and we have some of them here.
online?
They can tell you about the experience. I think some of them here. Yeah.
So how long this mock exams and institutions it is for
Uh,
how much period?
3 months for practice. 3 months for sessions. 3 days a week.
3 days a week, and it
Yeah,
will
for
go
three
for
months.
three
For three
months.
months, and
Okay,
there's subscription for the website material website.
fine, fine. Thank you very much.
You are welcome, Doctor
دكتور علي السلام
Adibayo.
عليكم.
عليكم السلام دكتور أحمد.
كيف حالك؟ طيب.
Alhamdulillah.
Yes, if you can give me 1 to 2 minutes just to tell to the
Okay,
people.
okay. All right, Dr. Ahmed. So, Dr. Ahmed, one of those colleagues who passed recently, actually. Yeah, Dr. Ahmed, you can have 1 or 2 minutes.
Yes, first, colleague, my colleagues, congratulations for the part A, and be sure that the part B, it is a real exam. It is not difficult and not easy. For my experience, I passed, alhamdulillah, first attempt for last Abu Dhabi, Edinburgh, which, as Dr. Ali tell you, about 40% the rate pass. Just I will give you tips for this exam. The part knowledge, anyone can pass because only need to memorize. But the problem mainly come for the skills part. Skills part is not only to read, need more practice. For my experience, I joined Dr. Ali course for 2 to 3 months before the exam, and Alhamdulillah, I will did well because nowadays the examiner don't need anything from you. Only we need how to be confident with the patient, how to deal with the patient, how to answer with the patient, how to listen to the patient. When you need to wash your hand, when you need to wear the gloves, we need to read for this 1 minute outside. They will give you a minute to read the scenario. You need to read well. For example, nowadays, for example, as I ask for the cranial nerves, no need all the examination. Just they write for you. Just do cranial nerve. Examine the cranial nerve 2, 7, 12 like this. If you don't read well, just you make mistake and you lose the station. So this is why you need to be confident. Dr. Ali course, the important for this Dr. Ali course, they tell you how to answer the patient. Any situation patient will put it, just you have solution for this. For example, they ask me, I cannot die, doctor. So what you will answer? Dr. Ali will tell you what you will do for this situation. For example, also the examiner tell me, please tell the patient what he will do if he have infection. Dr. Ali tell you what you will do for this situation. So nowadays the exam, as Dr. Ali tell you, just not just be like real patient. Just this your patient. Patient sometimes will crying. What we will offer tissue for the patient. We need to support patient has pain. Offer for him painkiller. Just put like this. I think I recommended Dr. Ali course because really I get benefit from this and I pass Alhamdulillah from the first attempt. Thank you, Dr.
Uh,
Ali.
Congratulations again, Dr. Ahmed, and thank you. Thank you so much. Dr. Adibayo.
Um, Good day. I'm Dr. Adibayo. I'm a Hafiz from Nigeria. I recently passed MRCS Part A exam for my first attempt.
Congratulations.
After almost, let me say, I decided to write the exam, to sit for the exam and started preparation on November 1st, 2025. So I prepared for almost like 2.5 months only with rigorous preparation. So although I'm a resident doctor in Nigeria, so firstly, I am a little bit confused on which material do we have a specific material to use in preparation for this Part B exam. On my own, I believe your preparation and your knowledge and how comfortable you are is you that will decide on your own. On if you are really ready for exam, you will know. Your mind will tell you. So, but how do we go about in the preparation? I'm confused about that. And then, does center matter? Do you have advice for us on where people like us from Nigeria should go and write the exam? I write Edinburgh. So I wrote Edinburgh, which I passed. Must I also apply through Edinburgh for the Part B exam? where do you advise to go and write the exam? Then I've recently joined a page where we usually do group discussion. So what are the other things you feel I need to do as like that, so as to increase my chances of passing the exam? Thank you very much.
Thank you, Dr. Adebayo, and congratulations again. So, as I mentioned, guys, there are 3 or 4 materials. I don't because they are named after the person who did the material. So I'm not going to name them. But if you ask in any of the groups, you're going to find 2 to 3 4 materials. Okay, so they are available, um, and they'll cover 80% of what you need to prepare for this exam. Okay, so they'll cover 80% of what do we need to prepare for this exam.